Hi, I'm Melanie Moyo, and I'm a medical doctor at Malawi-Liverpool-Wellcome Trust. I was a lead physician on the Ambition trial. Today, I'm discussing the Ambition regimen, flucytosine dosing, and toxicity management. The Ambition regimen involves a single high dose of liposomal amphotericin dosed at 10 milligrams per kg stat, combined with 14 days of flucytosine 100 milligrams per kg per day in 4 divided doses, and fluconazole 1200 milligrams once a day. To prevent amphotericin toxicity, we recommend prehydration with 20 millimoles of potassium chloride in 1 liter of normal saline prior to administration of the Ambisome infusion. We also preemptively supplement potassium and magnesium. The dosage for slow mag is 2 tablets once a day, and that of slow K is 2 tablets twice a day for 3 days. Flucytosine is dosed at 100 milligrams per kg per day in 4 divided doses. It is administered 6 hourly. Each tablet of flucytosine contains 500 milligrams. You can refer to the flucytosine dosing chart, which is divided in 5 kg weight bands. Depending on the weight of your patient, you may have an irregular number of flucytosine tablets administered at different times of the day. For example, your 50 kg patient will require 3 tablets at 6 a.m., 2 tablets at 12 noon, another 3 tablets at 6 p.m., and 2 tablets at 12 midnight. The side effects of flucytosine that are commonly encountered are related to bone marrow suppression. The patient may develop thrombocytopenia, neutropenia, or anemia. And these are exacerbated in renal impairment. As such, renal impairment requires dose adjustment of flucytosine. Dose adjustment is required when your creatinine clearance falls below 40 mL per minute. The principle is to increase the interval between doses rather than to reduce the number of tablets per dose. Take, for example, a 60 kg patient. The normal flucytosine dose would be 3 tablets 4 times a day. If his creatinine clearance is between 40 and 20 mL per minute, then he will receive 3 tablets 12 hourly, or 3 tablets twice a day. If the creatinine clearance falls between 20 and 10 mL per minute, he will receive 3 tablets once a day. And should it fall to less than 10 mL per minute, this patient will receive 3 tablets on alternate days. In the event that your patient develops neutropenia, management of flucytosine depends on the severity or grading of the neutropenia. Also, do consider other causes of neutropenia in such patients. If the neutrophil count is between 0.4 to 0.6, which is a grade 3 neutropenia, then you can continue with the flucytosine, but repeat the full blood count on the next day. If the grade 3 neutropenia is confirmed, then the dose of flucytosine should be halved. In grade 4 neutropenia, where the neutrophil count is less than 0.4, then you need to stop flucytosine and repeat the full blood count the next day. If it remains at grade 4 level, then you continue to hold flucytosine. If it improves to a grade 3 level, then you can restart the flucytosine at half the dose. If the neutrophil count has improved to grade 2 or and above, then you can restart flucytosine at the normal dose. The principles of flucytosine management in thrombocytopenia are the same as those in neutropenia. In grade 3 thrombocytopenia, where your platelet count is between 25 and 50, you do not stop the flucytosine just yet. You repeat the full blood count on the next day, and if grade 3 thrombocytopenia is confirmed, then you halve the dose of flucytosine. In grade 4 thrombocytopenia, which is a platelet count of less than 25, you stop flucytosine and repeat the full blood count the next day. If the platelet count remains less than 25, then you continue to hold flucytosine. If the platelet count has improved to grade 3 level, then you restart the flucytosine at half the dose. If the platelet count has improved to grade 2 level or above, you can restart flucytosine at the normal dose. Do remember that lumbar punctures are contraindicated when your platelet count falls below 50. As such, it is important to keep above these toxicities. Thank you.